as a public health expert, it would be good if you could frame up the issue a bit for us to start off. So give us an overview from a global epidemiological point of view. What can you tell us about the size and scale of the long COVID problem?
Yeah, well, thank you. Look, there are many well-established epidemiological frameworks for working out how important something is. And these look at questions like the size and scale of a problem. So how common is it? How long does it last? How severe? How treatable? How good is our evidence? How certain are we of it? And how do we think these indicators may track in the future? And I think, unfortunately, long COVID is causing huge concern on all of these fronts. A very detailed evidence summary was just prepared and published last week by the Public Health Communications Centre as a briefing, and there's a link to that on the event website. And this was led by my colleague, Dr. Amanda Klausvig, and it included myself, Paula, and Janine as co-authors. But what this evidence summary shows is what I think many of us have been become more and more aware of over time, that long COVID is not one condition, it's a collection of conditions. At the severe end, you have illness like circulatory diseases such as heart attacks and strokes, which can be fatal, and that's part of the spectrum of long COVID. It's certainly an established cause of ME and chronic fatigue syndrome, which we'll hear more about. It causes a very wide range of specific symptoms, particularly fatigue, and what is often called brain fog, but actually is cognitive damage to our brains. And these obviously have a huge impact on the quality of life and productivity of people. It also causes hidden effects. This is tissue damage and physiological changes that may not cause apparent symptoms at first, but may predispose to later disease. We just don't know yet. We have a large body now of well-designed studies that suggest the prevalence of long COVID is around in the range of 4 to 14% of people experiencing changes in their health status following COVID-19 infection. They may follow any variant or subvariant. They affect people of all ages. They can follow a first infection and reinfections. The duration, obviously, we don't know how long they'll last because this virus has only been with us for a bit over 4 years, but many people are experiencing long-term disability, and this may be permanent, particularly based on the experience of ME and CFS. We know it's unfortunately not curable at present and has limited treatment, so prevention is really critical. And what I would say is the evidence has firmed up over time. It's not just based on questionnaire and self-reported data, it's also based on testing, for example, brain scans that do identify physiological changes in the brain, in blood vessels, and other organs. There are also suggestions or concerns about its impact on the developing brains of children and adolescents, and also development of the fetus in utero. And one of the problems of COVID-19, as we all know, is that this virus itself, which causes long COVID, of course, is continuing to evolve. And that means the infection is always with us, and it's causing periodic waves of infection, particularly linked to new mutations of the virus, causing new waves of infection. So in summary, it is a very large problem for affected individuals, for societal functioning, and also our economy. And the evidence is overwhelming that we need a vigorous, evidence-informed response.
Brilliant. Thanks, Michael. That was a really, really nice, firm overview to get us started. Loads of things to bounce off there. Paula, I'm going to turn to you next. Would you be able to zoom in more on the New Zealand context a bit for us? So you've been doing a lot of research mapping patient experiences here in Aotearoa. What does your research tell us? What doesn't it tell us? And I'm particularly keen there to hear who's most affected, for example, what the condition looks like for people in terms of duration, severity, and so on. What can you tell us about patient experiences? Sorry, that was a lot of questions, but just tell us about your research.
Thanks very much, Carly. So as I alluded to in the introduction, Janine and I have created the Long COVID Registry, and this has been funded by the Ministry of Health. So it was established in July 2023. And the idea is to understand the burden or the impact of long COVID on those who are experiencing long COVID symptoms. So, what's the symptom profile? What is the impact on quality of life? What's the impact on people's employment, their ability to get benefits, impact on their whānau and the community, right? So kind of quite a broad and possibly at the time ambitious, now it's still very ambitious idea of trying to understand this huge impact. So REG started in July 2023. It's still going. I should say we're due to write a report for the ministry at the end of this month, and so there will be a final report, but we won't close the registry because, as Michael just said, COVID infection is still happening, long COVID is still happening, so we will still keep recruiting into the registry so we can understand the experience of individuals. We did a data extract. We're doing one right now at the moment for the final report, but the most current one I can report on was at the end of January, and we had nearly 1,300 people registered. And so predominantly they are female, and this aligns with the international evidence that there are higher odds of developing long COVID as a female. And I'm sure Warren can speak to the science on that. They have an average age of 45 to 49. And so I like to think that that's the kind of most productive part of your life. You're often a carer at both ends, right? You've got children and you've got parents that you're caring for. So, this is at a point when you're, a lot of people are relying on you. A third of the participants were essential workers and a number of them were health workers. And of course, we know that they were of greatest exposure because of their jobs. Nearly all are vaccinated, which is what you'd expect because this is New Zealand. We had mandates, and most were infected with the Omicron variant or the later variants. And it was actually because of that vaccination and the variant that I thought it was really important that in New Zealand, and the ministry obviously agreed this as well to fund us, that we actually created our own evidence because the experience of the pandemic in New Zealand was so different than it was elsewhere. And so what do we know about the individuals in our study? I was trying to think of one word that might kind of sum it up, and I'm sure most of the people that are on the webinar who've got experience of this, probably can't sum it up in one word, but I was thinking it's grim, it's stark, it's crushing, there's a lot of words like that. But one thing to point out is that these were healthy people before COVID, so we asked them in the registry, got them to recall what life was like. And we're not saying, they were all perfectly healthy. They weren't, but they were very similar to a study that's been done just on the general population, right? So they are Joe or Joanne Kiwi, right? Now that when they join the registry, now their quality of life is very similar to those individuals who've got cancer and MS. So that kind of just goes to show the kind of chronic burden of it. We've continued to track individuals monthly in terms of their quality of life. And for some, there's been some improvement. For others, they're still kind of flatlining at this quite low level of quality of life. We know people have had to reduce how much they're working, between 7 and 9 hours a week. We know that 30% plus have taken leave without pay. And we know that 70% of people are working despite being unwell. So, this is evidence of not just absenteeism, but something we call presenteeism. And it's no wonder, because when we look at symptoms, like 90% have had are reporting fatigue, which is not improved, sleep disturbances, loss of concentration, or what's often called brain fog, muscle and joint problems. These are all very common symptoms, and they kind of align with the international evidence. So actually, I could speak forever, and we will be speaking forever, not that long in the final report we'll write. But I just wanted to say that, for those who are interested, and we'll put the link in the chat, if you haven't yet joined the registry, please do join the registry, because this is one way that we are being able to aggregate the voice and the experience of individuals with that data. Yeah.